So, सबसे पहले तो अस्सलाम वालेकुम to everyone present here. My name is Zhalay Sarhadi. I'll give a little brief introduction to myself. I'm an actor, and as you can see, a woman. I'm also a mother, and I'm a sister, and I'm a daughter, and I have plenty of women in my life who I every year try to educate and educate myself also on this cause that we are talking about right now. So basically, ब्रेस्ट कैंसर एक ऐसा कैंसर है जो सबसे ज़्यादा प्रेवलेंट है. WHO ने इसे डिक्लेयर किया है एज द मोस्ट कॉमन कैंसर प्रेजेंट इन वुमेन, एंड इट्स नॉट जस्ट प्रेजेंट इन वुमेन, इट्स ऑल्सो प्रेजेंट इन मेन. बट औरतों को ज़्यादा अफेक्ट करता है, तो हम स्पेसिफिकली औरतों के हवाले से बात करते हैं हर साल. और इसकी अवेयरनेस के हवाले से जो हम बात करते हैं, उसका मतलब ये है कि ब्रेस्ट कैंसर इज़ एक्चुअली वेरी प्रिवेंटेबल, एंड अगर उसके अर्ली स्टेजेस में डिटेक्शन हो जाए तो उसकी ट्रीटमेंट स्टार्ट हो सकती है, और ट्रीटमेंट स्टार्ट करना जो है इज़ द फर्स्ट स्टेप. सो टुडे वी आर ऑल हियर विथ वीट एकेडमी, जो कि काफ़ी टाइम से ब्रेस्ट कैंसर अवेयरनेस के लिए काम कर रहा है, और इस दफ़ा उन्होंने पार्टनरशिप की है विथ शौकत खानम कैंसर हॉस्पिटल, विच इज़ द मोस्ट आई थिंक ऑसम पार्टनरशिप, बिकॉज कैंसर के लिए स्पेसिफिकली ये हॉस्पिटल बहुत काम करता है. सो लेट मी टॉक अबाउट अ लिटिल अबाउट द वीट एकेडमी और व्हाट दे डू. सो अक्टूबर का महीना हम सब जानते हैं कि इसे पिंक टोबर कहा गया है. सो अक्टूबर का महीना जो है इट्स कॉल्ड पिंक टोबर. और पिंक टोबर इज स्पेसिफिकली फॉर ब्रेस्ट कैंसर. तो इस पूरे महीने जो है वो ब्रेस्ट कैंसर के ऊपर बात होती है, अवेयरनेस के ऊपर बात होती है, इसकी अर्ली डिटेक्शन के ऊपर बात होती है. सो वीट एकेडमी, अ प्लेटफॉर्म एस्टैब्लिश्ड बाय वीट, लड़कियों को उनकी मंजिलों से करीब लाता है while removing barriers. One of those barriers is a disease that can be limited, like I said earlier, if उसकी डिटेक्शन earlier on हो जाए. So to overcome this issue, Veet Academy has been raising awareness on this topic, and this year it has collaborated with Shaukat Khanam Cancer Hospital to educate more and more people. Now, this education is not only limited to women. जो मर्द हजरात आपके इर्द गिर्द हैं, अभी मैं जो थोड़ी देर में टैबूज़ के ऊपर बात करूँगी, तो आपको इस बात का अंदाज़ा होगा कि इसकी डिटेक्शन इसलिए नहीं हो पाती बिकॉज देयर सो मेनी टैबूज़ एसोसिएटेड विद दिस इलनेस, दिस डिजीज़. सो इसके लिए ये अवेयरनेस फैलाना बहुत ज़रूरी है, एंड आई कमेंड बोथ वीट एकेडमी एंड शौकत खानम हॉस्पिटल फॉर दिस कोलैबोरेशन एंड दिस रेजिंग ऑफ अवेयरनेस, एंड ऑल ऑफ यू हु आर हियर, क्योंकि जितने लोग यहाँ मौजूद होंगे उतने ही ज़्यादा ज़बानें आप आगे जाके खोलेंगे, उतने ही ज़्यादा लोगों तक वर्ड ऑफ माउथ फैलाएंगे, अपने दोस्तों में, अपनी बहनों में, अपने घर वालों को, एंड ऑल्सो आदमियों को, ताकि वो अपने साथ की जितनी भी ख़वातीन हैं, चाहे उनकी बहनें हों, बेटियां हों, या दोस्तें हों, या माएँ हों, उनको अवेयर कर सकें और उनको कंफर्टेबल कर सकें कि वो इस चीज़ की जाके डिटेक्शन कर सकें और गायनोकोलॉजिस्ट के पास जो है वो चेकअप करवा सकें. So, about the partnership, Veet Academy's partnership with Shaukat Khanam is not just restricted to spreading awareness. In fact, they have also donated to help increase access of safe treatment to those affected by the disease. So, ना सिर्फ इसकी awareness फैलाना मकसद है, बल्कि मकसद ये भी है कि donations जाएंगी towards to help increase the access of safe treatment, यानी कि safe treatment मुहैया की जाए उन patients को जो कि इस मर्ज से गुजर रहे हैं. सो ये भी बहुत ज़रूरी है जानना कि इस पार्टनरशिप में सिर्फ आपको से बताया नहीं जा रहा कि ब्रेस्ट कैंसर जो है वो मौजूद है और इसकी डिटेक्शन कैसे हो सकती है, बल्कि आगे जाके जब वो डिटेक्ट हो जाता है सो उसको प्रिवेंट करने में या उसको क्योर करने में किस तरह से आगे कोशां काम किया जा सकता है. बिफोर वी मूव अहेड, I would like to get someone to play the campaign video so you can see what I'm exactly talking about. So cue to the campaign video please. So before video play की जाए, मैं टैबूज़ के ऊपर भी थोड़ी सी रोशनी डालना चाहती हूँ. अब हमारे माशरे में माशरती टैबूज़ बहुत सारे हैं, जो कल्चरल भी हैं, ट्रेडिशनल भी हैं, एंड आपके घर में भी आपको ऐसी चीज़ें जो हैं वो स्पेशली औरतों को लेकर ऐसी चीज़ों के ऊपर पर्दादारी डाली जाती है जहाँ पे पर्दादारी डालना अब बहुत फेटल हो सकता है. सो आप वुमेन जैसे कि आप सब जानते हैं, अगर आपने घर में देखा हो, आपकी माएँ अपना ख्याल बहुत कम रखती हैं. और उसकी वजह ये होती है कि उनका सारा फोकस अपनी फैमिली पे होता है, अपने बच्चों पे होता है, अपने शौहर पे होता है, बिकॉज शौहर भी एक तरीके से बच्चे ही होते हैं. आई डोंट नो हाउ मेनी पीपल आर मैरिड ओवर हियर, बट इफ दे आर दे वुड नो व्हाट आई एम टॉकिंग अबाउट. सो इस रेस में वो अपना ख्याल रखना भूल जाते हैं. और हमें मोस्टली ये बताया गया है, मुझे तो ख़ास करके मेरे घर में, कि आपकी अगर सेहत अच्छी नहीं होगी तो आप घर कैसे चलाएंगे. ठीक है, क्योंकि सरबराही जो है, चाहे आप बाहर काम करती हो चाहे आप घर में हो, औरतों की ही सरबराही चलती है. बच्चों की नशोनुमा भी उनके हाथ में होती है, घर का खाना कब बनेगा, कैसे बनेगा, सब उनके हाथ में होगी. और अगर आपकी सेहत ठीक नहीं होगी तो ये सब कैसे चलेगा. सो ये टैबू से हमें ज़रा दूर हटना है. ख़वातीन जो है वो घबराती हैं डॉक्टर्स के पास जाते हुए, स्पेशली जो सिंगल ख़वातीन हैं वो घबराती हैं गायनाकोलॉजिस्ट के पास जाते हुए, बिकॉज उनसे सवालात पूछे जाते हैं कि गायनाकोलॉजिस्ट के पास क्यों जाना है, आपकी तो शादी नहीं हुई, आपकी तो वो वाली ज़िंदगी शुरू नहीं हुई जहाँ आपको ज़रूरत पड़ती है ऐसे डॉक्टर्स के पास जाने की, जो कि बहुत ही गलत सोच है. गायनाकोलॉजिस्ट आर नॉट जस्ट देयर टू चेक द taboo areas of your body, they are there to detect various illnesses. हम यहाँ पर ब्रेस्ट कैंसर के हवाले से बात कर रहे हैं, बल्कि इसके अलावा ओवरीज के भी कैंसर होते हैं. देर आर लॉट्स ऑफ अदर इश्यूज़ जो ख़वातीन को दरपेश होते हैं. मेरा माइक बंद हो गया था. हाँ, तो इसके लिए हमें ज़रा खुल के बात करना बहुत ज़रूरी है. जब तक इन चीज़ों पे बात नहीं होगी, ये बातें जो हैं कॉमन नहीं होंगी और लोग इसे टैबू ही समझेंगे. सेल्फ एग्जामिनेशन से बात शुरू होती है. आई होप कि क्योंकि इस पे बहुत सालों से बहुत ज़्यादा गुफ्तगू चल रही है, तो एवरीवन सेल्फ एग्जामिन्स देमसेल्व्स. आई होप दे डू, एंड इफ़ दे डोंट तो आई होप कि एक एनुअल चेकअप के लिए तो लोग जाते होंगे, बिकॉज दैट इज़ ऑल्सो very very necessary and vital. And this is not, again I would press upon this fact, for just women who are married or of a certain age. This ailment can be caused within women of any age bracket. So please everyone, I urge you, आपकी बेटियां हों, आपकी बहनें हों, आपकी माएँ हों या आप खुद हों, प्लीज़ जाइए डॉक्टर्स के पास जाके चेकअप कीजिए और एक दूसरे से सवाल कीजिए. अपनी सहेलियों से ये सवाल कीजिए कि तुमने करवाया है नहीं करवाया. मेक इट अ थिंग नाउ. Okay, so before we commence the show, I have this beautiful lady sitting on my right here. This is Dr. Seemin Jamali, okay, and I will tell you a little bit about her. She is actually a cancer survivor, and cancer जैसा जो मर्ज़ है उसको survive करना is mentally, emotionally and physically, it takes a toll on your system. And I am very grateful that she's sitting amongst us over here, and she will enlighten us about her journey of how she got this cancer detected and what other hindrances she had to face during the cure of this disease. She is also a Tamgha Imtiaz winner. I think 2019 you won. Yes. Tamgha Imtiaz along with other accolades. But I would be very happy for her to introduce herself through her own words. So please give a round of applause for Dr. Seemin Jamali.
Thank you very much. Thank you so much, Zhalay. You've made my day actually. I would be very grateful कि पीछे वाले लोग जो हैं ज़रा आगे आके बैठ जाएं, so that you know we can really talk about what has been going on with me. If it's come in front, we'll be able to enjoy and hear what has been going on, and you know this disease can happen to anybody. I have been working at the Jinnah Postgraduate Medical Center for the last 33 years. I just recently retired, and before I retired in the year 2020, when COVID was just coming around, COVID was just around there. 2020, there was a plane crash, if you remember, in Malir, right? Yes. So that was the night when I was there in the emergency room, and I was trying to get the dead bodies shifted to the mortuary. There were 2 survivors, very lucky people, and one of them went to a private institution right away. He had some relatives there. The president of the Bank of Punjab, he was a survivor from that crash, and there was one more person who survived, and thankfully he's still alive and well. So after that plane crash, I realized that I had severe abdominal pain. Now I'm not a cancer survivor of breast cancer. I suffered very severe pain in my abdomen. And I went to the, because I was a doctor, I actually walked up to the CT scan after everything was done with, and about midnight I walked there and I said that to the doctor that I just want to have a scan. So when I had a scan, I had such severe abdominal pain that I could not bear it. So I said that, you know, there's something terribly wrong with me. And then there was this doctor there was standing next to me, and he said that, no, you have an obstruction in the right side of your gut. So I said, what is it? He said that I think it could be tuberculosis, it could be inflammation. I said, I'm too well to have inflammation. I've worked 24/7 in the emergency, and I have been working there day and night in the hospital. So I don't think I could have tuberculosis. And then, lo and behold, the next morning I was really, really sick. But because of the plane crash, we had to get to the hospital. And the day after, I was examined by a surgeon, very, very good surgeon. Let me tell you how much difference it makes to the life of people when you have good doctors. And आजकल की दुनिया में people, you know, just want to pass the exam, and you know, ये exam pass कर लिया, वो exam pass कर लिया. But you need to be good people, and you need to be good doctors to, you know, treat patients. And this doctor was a fantastic guy, and he consoled me because patients, attendants were not allowed. My husband was suffering COVID, and he was in the ICU in AKU, and he was a doctor himself. And I, being a doctor, the head of an institution, I thought because my privacy would be hindered in my own institution, I went to the AKU, and there I was operated the next morning. And you can't imagine how bad I felt. I did not shed a tear. You have to trust me, I did not shed a tear when I learned that I had cancer. I had already guessed that I had cancer. And people like me who are crazy working, who are very passionate about their work, I worked for, say, like 24/7. Emergency was very, very bad in the years like 2010, 11, 12. They were the worst years of Karachi, you know, the city of lights. There were years when, you know, people, there was a bomb blast every day. And in my lifetime, I have seen and treated patients over 250 bomb blasts at least. I have seen all the dead. I have seen the Nishtar Park blast. I have seen the Marriott blast, the Wari Towers blast. I have seen the 18th October blast. You name it, and I have seen it all. So with those kind of guts, that's why I was usually called the Iron Lady and the bomb-proof lady. There was a bomb blast already in our hospital in which 18 people died at our emergency door, and I was also injured in the same. But I didn't even for once think that, you know, I'm not fit to work. You know, women really shy away. My family was very upset. I have two boys, two young boys, and they were very little at that time, but they were like, they were saying, Mama, don't go back to work. Mama, don't go back to work. And, you know, at that point in time, the media was very insensitive to what used to happen. For example, in the Nishtar Park blast, there was this man who comes to me, and he gave me a decapitated head in my hands. You can't believe it. I was wearing gloves, thankfully, and I was all full of blood everywhere. And he gives me a decapitated head, and I had to, I just gave it to the police guy who was next to me, and I said that, please put this away. And this was how the media showed that exactly. So my kids were so upset. They said that, Mama, don't go back to the hospital. And when they realized that I was suffering such a horrible disease, you know, cancer is a death line. Everybody thinks that when you're suffering cancer, that it is the end of life. Yeah, it's a death sentence. So then after I had a hemicolectomy, which means half my colon was operated upon. And then after that, I had chemotherapy. This is the most tough thing that you can ever think of. I had a head full of hair. You cannot imagine. I had a head full of hair. If you look at my pictures, you would be surprised. Everybody used to always say, she has the mane of a lioness, and she has this and that. I had a lot of hair. So when I had chemotherapy, the fear was that I didn't want to have chemotherapy, but the fear was that I'm going to lose all my hair. That is a great stigma in cancer. So, and I did lose half my head. I could see that I was losing my hair. People didn't realize because I had a lot of hair. So that is something that happens in chemotherapy. After that, I realized that my my CEA, which is one of something that tells you how your cancer is progressing or regressing. So it was going higher, and I was wondering what's wrong. And then I went to the doctor back again after 6 months of chemotherapy. I went back and I said that okay, my CE is going high. We are under observation for several years actually. So in the next 3 months, I had to be reoperated because it went into my right lung. So you can imagine how I felt. I thought now it's over. And this was much more painful than the first surgery, because the first surgery I was able to go back to work in 10 days. Here with the lung, I couldn't go back for say 2 weeks, and it was really, really very painful. And then I traveled abroad and I went to the US, and they said that the line of treatment was absolutely fine. But you know what the doctor said before I was getting out of his office? And this was the Sloan Kettering Hospital in New York, which is one of the best cancer hospitals you could think of over there. So he said, I think it's going to come back, so don't get upset, it may come back. He said it so gently, I didn't understand, but I came back with a very heavy heart. I thought, okay, bus, this is the end of life, it's going to come back and it's going to put me off. I had another session of chemotherapy when I came back because my CEA was again rising, and another session, and this didn't work, and then I had immunotherapy and that didn't work, and then my ureters were stented, 1, 2, 3 surgeries, then my sigmoid colon was stented, another surgery. I am still on chemotherapy, but I survived. I fought this disease. I thought we had to fight. I didn't want to give up for a single day. I thought, what's going to happen to my kids? What's going to happen to my family, my sisters? They are all not going to make it. I was the person who helped millions of people, not thousands. They could be millions of people in the hospital in 33 years that I could have helped, and I did help. But I thought we have to survive this, we have to fight it, and we have to get over it. So even now I am on chemotherapy, and it's the last kind of chemotherapy. It's not available in Pakistan, but with great difficulty I just managed to get that drug. It's very difficult. It makes you very weak. Every time you walk around, you want to sit down. I get breathless. I have been transfused blood 3 days ago. My hemoglobin fell down. Again, I have a transfusion tomorrow. I promised this young girl over here that I'm going to come here and I'm going to speak, because it's very difficult for people to come up and stand up and speak for themselves and give this positive message to people that yes, it will work. You have to fight it. We cannot just give up. Don't give up on life. It comes only once. We only live once. We have only one life to live, and don't give up. So this is the story of my life. This is what happened to me. And Zhalay, I want to tell you one thing. There were a number of times when I wanted to sit down and cry, and I didn't shed a tear. I did not shed a tear, and I did not want to do that. I don't want to be a weak woman. I want to be a strong woman. And why did people call me the Iron Lady? Why? I recently got the award for being a Lieutenant Colonel in the Pakistan Army. I'm the first woman, I think, who's got this award. And I've not heard of anybody getting an award like this. I have been brave enough. I've been fighting, and it's one life to live. I think everybody must be positive. And I think there's one more message that I want to give through everybody, through this IBA chapter also, that we the doctors must be very compassionate to patients. We cannot be unkind to patients. Not for a day did my oncologist or my surgeon say that, oh, you're not going to live, chodo apas, chhod do treatment. They did anything and everything that came to mind. I read everything thoroughly. Because I was a doctor, I read everything thoroughly in the book, and I knew that they were trying their best, and still I'm trying, and still I'm fighting through it, and inshallah we will make it one day. Thank you very much. So you have to pray for me now.
All our prayers. You have to keep the mic with you. We're not letting you go.
Oh, okay.
मैं आपसे सवाल भी पूछना चाहती थी. आपने बहुत अच्छी तरीके से अपनी स्टोरी में बहुत सारी चीज़ें क्लियर की हैं, for which I'm utterly grateful, and I'm really thankful that आप यहाँ आके and you've been actually talking about this cause for a while now. So for me, अस्सलाम वालेकुम जी, कैसी हैं आप? Not at all. So मेरा जो आपसे बेसिकली सवाल है, बिकॉज मेरे पास जितने क्वेश्चंस थे वो सब आपने कवर किए हैं, बट व्हाट आई वुड रियली लाइक टू नो, जो आपने अभी सवाल उठाया था अबाउट कंपैशन. सो आई वुड लाइक टू टेल यू अ लिटिल स्टोरी अबाउट माई सेल्फ. So when I had my child, I have one daughter, and after my pregnancy, I developed a cyst in my left breast. So I went for a preliminary checkup, and वो जो क्या कहते हैं, टेक्नीशियन होती हैं जिनके पास, आई डोंट नो एग्जैक्टली उनका नाम,
मैमोग्राफी जो करती हैं,
वो तो बात की, अभी तक मैं उनके पास भी नहीं गई.
अच्छा, okay.
मेरा सिर्फ वो हो रहा है अल्ट्रासाउंड. Okay. Sonologist. So this lady, this sonologist, just did a little bit of an ultrasound on me, and she straight up told me that you have cancer.
Oh.
Okay, and now and this is a new mother, like my daughter is like 2 months old, and I am still feeding her, and I find this out, and I am absolutely aghast कि मैं क्या करूँ अब. और मुझे तो ये नहीं पता कि मुझे किसी स्पेशलिस्ट के पास जाना है, बिकॉज आई वॉज, आई थिंक 25, 26, सो आई वॉज fairly young, and I hadn't, and this is why I keep on saying that this importance of educating our girls is so great. Not just about breast cancer, but about postpartum depression and so many other things जिनको taboo बना दिया जाता है. So then I went to, my gynecologist wasn't in the country, she wasn't available, so because she was so amazing, this is Dr. Zina Tiva, she was I love her.
Yeah.
So I messaged her, and she sent me to a doctor who, sorry, I will butcher the word. Mammography वाले जो डॉक्टर के पास मैं गई, एंड आई टोल्ड हर कि मेरा चेकअप हो. उन्होंने मेरा चेकअप किया, उन्होंने कहा आपको कैसे बता सकते हैं, दैट इज़ एब्सोल्युटली अनएथिकल. इट वाज जस्ट सम काइंड ऑफ अ स्टैफिलोकोकस, कोई इन्फेक्शन था जो मुझे था, एंड उसकी वजह से वो छोटी सी सिस्ट बनी थी. But this point that you just raised is also very, very important for doctors to actually have, you know, that kind of ethical sympathy and compassion for whichever patients that comes. क्योंकि end of the day आपकी reliance on doctors is your reliance on God, literally. अब आपकी जो journey है, please you wanted to say something.
No, I just wanted to say that, you know, I had no attendant. I had no attendant because of COVID. We were not allowed to have any attendant, and my husband was sick. My young child was at home guarding the house. He was only 15 and a half at that time, and my other son was abroad. He couldn't travel because of COVID restrictions. He couldn't travel back to Pakistan. So you know, the only person I had was my surgeon, and he would come twice a day to me to visit me and see that he would make sure that everything is okay with me. I had nobody else. I had friends who could have come, but unfortunately all of them were doctors. Everybody was exposed to COVID. Most of them had COVID, and I think the doctor was so excellent. I don't have any qualms in naming him. This was Dr. Inampal from the Khanam hospital. He was really, really so good that I can't tell you. And it's very important to be compassionate. Not for a minute did he, you know, say, and he explained to me what I had. He explained to me that what he had resected. He explained to me that, you know, nothing is going to happen. You'll be fine. He just kept telling me you'll be fine. 2.5 years from that time until now, I'm okay. I just made it till 2.5 years.
Mashallah. So it's not just the medical help that you need, it's also the emotional and the mental health. The mental health that is required, because जो आप बार बार बात करते हैं of will power.
Yes.
So will power जो है वो इतना strong होता है कि मैंने बहुत सारे instances सुने भी हैं, देखे भी हैं कि वो आपके you just power through with your willpower. And if you have awareness, I come back again to this, if you have awareness of a certain disease, और अगर आपको उसके बारे में बार बार बताया जाता है, so you start accepting that it exists. And then when you accept it, then आपका defense mechanism mentally grow होना शुरू होता है, which is why these talks on awareness is so important. आप जाते जाते मुझे सिर्फ आपसे ये सवाल था कि बिकॉज यू वर अ डॉक्टर एंड यू वर अ पेशेंट ऑफ कैंसर, सो आई एम श्योर आपकी नो हाउ भी ज़्यादा थी, सो यू केम विद अ सर्टेन अमाउंट। आई नो कि आपने अपने हिसाब से नहीं सोचा होगा कि मैं कभी कैंसर पेशेंट होंगी, बट आपको फिर भी इसके बारे में थोड़ी बहुत नॉलेज थी। सो फॉर अ ले मैन, फॉर इंस्टेंस फॉर women in society, specifically talking about breast cancer, what needs to be said to them? What should they know to expect when they go to a doctor for a checkup? ये थोड़ा बहुत अपने पर्सनल एक्सपीरियंस से आप मुझे बता दीजिए।
ओके, अगर ब्रेस्ट कैंसर के बारे में हम बात करें, बिकॉज दिस इज पिंकटोबर एंड वी टॉकिंग बेसिकली वी वर टॉकिंग अबाउट ब्रेस्ट कैंसर, सो इफ़ यू हैव अ लंप इन द ब्रेस्ट, इफ़ यू हैव anything, you feel any abnormality in your breast, and if you want to go to a breast surgeon or a breast somebody who knows about breast, either a gynecologist, or best way is to go to a breast surgeon. We have so many breast surgeons now, everything is a specialty. So in that specialty you go to a breast surgeon and they will definitely tell you, they will do a biopsy on you if required, they'll do a mammography, an ultrasound, and see what you have. If they cannot right away say that you have cancer, like what they did with it. It was very unkind of that person, whosoever that person was. You can't say that. Even my CT scan, the doctor who did a CT on me did not say right away. He was talking of other things. He started talking of tuberculosis, which I was 100% sure. And the other thing is that, you don't take doctors, being doctors, we're very careless. We never took care of ourselves. I was always very anemic, and I used to walk around in the hospital and I used to get tired very easily. So when I went to the doctor, I said, oh, you don't eat well, your diet is very poor, so you have iron deficiency anemia, and they didn't tell me that you'd get these tests, and I was lazy myself. I was working full time, so I thought that कोई ज़रूरत नहीं है टेस्ट कराने की, but टेस्ट कराने की ज़रूरत है. If you think that you have a lump in the breast, if you think that you have examined, you need to examine yourself every month, at least once a month. If you have something in your axillary area, if you think that there is something, the puckering of the skin or something else, the skin abnormality, some discoloration, you must go to the doctor, and definitely you must have an ultrasound, you must have a mammography, you must be seen by a breast surgeon, and if necessary have a biopsy so that you can come to a conclusion. Do not ignore it at any time. बहुत मिथ्स होते हैं कि जी ज़्यादा हाथ लगाने से ब्रेस्ट कैंसर हो जाएगा, कुछ और इतने मिथ्स होते हैं. पीपल हैव ऑल सॉर्ट्स ऑफ स्टोरीज कि ये हो जाएगा वो हो जाएगा, लेकिन आई थिंक यू शुड नॉट बिलीव इट. आई थिंक यू शुड गो बाय द बुक एंड डू दिस. अवेयरनेस के लिए आपके पास आजकल सेल फोन्स होंगे, हर एक के पास सेल फोन पे एक मैसेज चल रहा होता है. फॉर द मंथ ऑफ अक्टूबर यू हैव दिस मैसेज दैट अगर आपको कोई लंप, उर्दू में इंग्लिश में हर तरह बता रहे, इफ़ यू फील दैट यू हैव अ लंप, आई थिंक यू शुड गो एंड सी ए डॉक्टर राइट अवे. यू शुड नॉट बी वेटिंग कि आप वेट कर रहे हैं. एंड प्लीज़ लाइक मी, जैसे मुझे डर लगता था बहुत, मुझे आज भी डर लगता है, मैं आज भी कीमोथेरेपी पर हूँ. लुक माई हेयर इज स्टिल देयर, माई everything is there. I had some numbness in my hands. I used to write a lot. I may not be able to write that fast now, but I have some numbness in my hands because of the chemo, which people do have. But there is nothing, life will not, life will come, be there.
You're still here, you're talking to us, you're a survivor, you're an iron lady, and I can't thank you enough for coming forward and, being an inspiration for so many women and so many students out here, जिनको आप एजुकेट कर सकती हैं अपनी स्टोरी के साथ, अपने डॉक्टर होने के नाते. सो आई एम truly grateful and thank you so much for coming here.
Thank you so much, Zhalay. Thank you very much. Thank you everybody. Thank you.
So our next guest over here is Dr. Ayesha Hasan. She's a medical officer at Shaukat Khanam Memorial and Shaukat Khanam Cancer Hospital, which is, as you all know, goes without saying, goes without any introduction, the hospital that works endlessly towards the cancer research, development and cure. So I am very glad to have her here, ताकि आप लोग जो यहाँ बैठे हैं, जिस तरह से अभी डॉक्टर सीमी से हमारी गुफ्तगू हुई, इस तरह से डॉक्टर आयशा जो हैं वो इन्फॉर्म करती हैं, अवेयर करती हैं कि कब चेकअप कराना चाहिए, कैसे करना चाहिए, कौन से टैबूज हैं और मिथ्स हैं जो बस करने चाहिए. सो आई वुड लेट हर टेक द स्टैंड एंड आई होप आप भी इनकी बात गौर से सुनेंगे. सो इट्स हाई टाइम दैट एवरीवन ओपन्स देयर ईयर्स एंड स्टार्ट लिसनिंग.
Assalamualaikum. Thank you for having us.
Thank you.
And yes, we're going to talk about that. There's a presentation, so we can start that. And yeah, Madam is an icon for us. She
Yes.
taught us, and I did my MBBS from SMC.
Okay.
So back in the day, our house jobs and our rotations used to be in Jinnah.
She's also a teacher.
Yeah, she's like that, that jab bhi koi, incidences used to happen, so she used to be standing right in front, irrespective of, all the fears and the threats. So she's like that source of inspiration for so many like us.
MashaAllah. Yeah. So we actually had the intro, but I would like you to tell everyone over here right before the video plays and the presentation happens, what exactly is your designation, and what do you want everyone to know that they should do for the prevention of breast cancer?
Yes, absolutely. Assalamu alaikum. I'm Dr. Ayesha. I am with Shaukat Khanam as a medical officer. We are a part of this campaign for the breast cancer awareness sessions that we conduct every month of October. Because this is a very highly prevalent cancer in the society. And at Shaukat Khanam, if you talk about Shaukat Khanam specific, the highest number of cases of cancer that we get are of breast cancer, 22%.
Okay, so it's 1 out of every 9 women, right?
It's absolutely. So it's a very common cancer. However, it's the most treatable and the most curable cancer out there. And it's just very unfortunate that, women are dying because of a cancer. Cancer itself is such a scary word, but losing precious lives to a cancer which is treatable, had it been detected timely, that's the key thing that we want to talk about. So sessions such as these and, going out, reaching out to all sorts of people, not just, corporates, not just universities, but actually schools, even the underprivileged, and we're getting a lot of response from everywhere because people want to know, they have questions. So we are here to answer those, and there are certain myths like we'll discuss this in the slides also. There are a lot of myths associated with breast cancer because वो fear of the unknown होता है ना, so we can come up with all sorts of excuses and justifications. So we are going to work through those, what are the symptoms, and how to go about it. So Shaukat Khanam takes it very seriously because again preventable cancer की बात तो curable ठीक है अगर बात करें तो it's highly curable.
It is, and if it's detected earlier on.
Absolutely.
Right? अच्छा मैं बहुत अरसे से सुन रही हूँ मतलब अब तो because I've been associated with this myself also. So I've been listening to this. We've been spoon feeding people, right? Yeah. So people like us who are privileged people, जिनको access है to educational institutes or access to hospitals, जहाँ seminars में हम जा सकते हैं. What about those classes where we have to reach out to them?
Yes, absolutely.
So उनकी तरफ जाने का या उनको information पहुँचाने का क्या तरीका है?
देखिए, again, you all can help. We all, I think the corporates are doing a great job in this aspect. We are going to mills, we are going to factories, they're making sure that, the people who are working there get this message. So in all sorts of languages and very easy literature that's distributed. And then again, WHO has also given certain guidelines that we have to follow. जैसे अब वो जो phone के ऊपर जो awareness call करें तो you get those messages, right? So they are again a part of that awareness campaign. People are again at least talking about it. At least they are looking up, Google कर रहे हैं तो जितना है, I think knowledge जो है ना इस तरह की वो 1 से 2 को बताए, 2 से 4 होते हैं, 4 से it just but yes. And obviously awareness sessions are really important.
They are. मैं बार-बार ये stress करती रहती हूँ अपने हवाले से because I'm technically a layman, right? I am not an official, I am not a doctor, I'm just a woman, a human existing in society like you all, and whatever problems you face, I face. So मेरी or whatever things that help me would obviously help you. So for me, what greatly helps is the people who are influential in your life. Right, like आपने जैसे कहा, आपने mention किया कि Dr. Seemi was a teacher, so you look up to her because of that. So whatever she says holds some weightage. So for me, it's my friends, my mother, my sister, my father, my husband. So which is why I think these kind of sessions makes it important and easier for us to have conversations at home.
Yes, because it is considered a social taboo.
It is considered. And why is it considered? I want you to स्पेसिफिकली बिकॉज मैं जिस ज़बान में बोलती हूँ आई थिंक वो थोड़ी ऑफेंसिव हो जाती है लोगों के लिए, और क्योंकि मैं एक अदाकारा हूँ तो अदाकाराओं को भी वो एक अजीब तरीके की नज़र से देखा जाता है जिसमें लफ्ज़ फहाशी की जाती है बहुत ज़्यादा। सो प्लीज़ फहाशी से हटाकर आप इस बात को क्लैरिफाई कीजिए कि ब्रेस्ट कैंसर के इर्द गिर्द ये टैबू क्यों?
क्योंकि अगेन it's just basically we tend to objectify women, you know, एक तो ये बात है, plus we forget the functionality.
Thank you.
Everybody in this world who comes in, I mean माँ ही पैदा करती है और माँ के साथ साथ कुदरत ने रिस्क भेजता है बच्चे का, और वो that's through the mammary gland. Every specific part of your body carries a function.
Yes.
And just like any part of your body can get cancer, breast is also prone. It's a mammary gland. It's where you get your milk from. The child thrives on it. So basically that's what pretty much answers it. So I mean, you know, you don't.
Yeah, you view it in that way.
Yes.
So ये viewing जो है वो खत्म हो जानी चाहिए. This is a part of your body which will affect एक तो आप जो life create करते हो उसको and आपकी अपनी life को. So going to a gynecologist is another issue. वैसे by the way, which I also want to highlight over here, जब वो वीडियो प्ले होना शुरू होगी उससे पहले मैं कुछ pointers. Why is it such a taboo? Okay, so in my household it wasn't.
Okay.
हमें थैंकफुली एजुकेट किया गया था कि नहीं जाना ज़रूरी होता है, डॉक्टर्स के ऊपर ट्रस्ट करना थोड़ा सा ज़रूरी होता है बिकॉज वो हमारे लिए ही मौजूद हैं. सो हर तरह की चीज़ को मद्देनज़र रखना चाहिए. अगर आपको छींकें खांसी बहुत देर तक आ रही है तो यू गो टू अ डॉक्टर. सो इफ़ यू आर हैविंग इश्यूज इन दैट अरीना यू हैव टू गो टू अ डॉक्टर. यू कैन नॉट सेल्फ मेडिकेट. एंड आप पूरे मोहल्ले को बता के नहीं जाते डॉक्टर के पास. आप ये अपनी माँ को बता के जाते हैं, अपनी बहन को, अपने बाप भाई को भी नहीं आप बताते. सो ये मसला क्यों है गायनेकोलॉजिस्ट के पास जाने का?
That's again literacy awareness की बात है. और ये एक concept ख़वातीन में ख़ास तौर पे ज़्यादा पाया जाता है कि we think कि कुछ नहीं होता, this is not going to happen. You know, we have grown up seeing our mothers working in the kitchen. We never saw them falling sick or taking bed, you know. कुछ भी होता था तो they are like cooking and they're making sure that the food is served hot and, you know, fresh. Again, because women generally they tend to keep their health at the back burner. They don't want to, you know, address their issues that are going on. Plus, unfortunately, गाड़ी खराब होती है तो मैकेनिक के पास जाते हैं. But अगर तबीयत खराब होती है तो गूगल के पास जाते हैं. You know, we resort to those घरेलू home remedies. So that's not a good thing. And again, going to gynecologists because specifically they are again addressing the issues of the specific areas of the female anatomy. So also usko socially it's looked down upon. I don't know why though, but again lack of awareness and education.
It is, I think it should become mandatory कि साल में एक दफ़ा annual checkup कराना सबके लिए ज़रूरी है.
बिल्कुल, absolutely, that's what we are you know, routing for. We want people to go to the doctor. We want them to go for mammograms. And again, October Green being a great month, a lot of companies are working on that.
Absolutely. So we have the presentation finally there. We can continue with this really enlightening conversation that I was having with you. ये सारे वो वाले सवाल हैं जो मैं पूछना चाहती थी. So but let's go ahead with the presentation. We have this video जिसमें आप लोगों के भी बहुत सारे सवालात के जवाब होंगे. तो डॉक्टर आयशा, I think let's go ahead with that.
हम अपनी लाइफ में कितने लोगों से प्यार करते हैं? अम्मी, नानी, बहन, खाला, बेटी, कजिन, बेस्ट फ्रेंड, ऑफिस की कलीग. क्या आप जानते हैं पाकिस्तान में हर 9 में से 1 औरत को ब्रेस्ट कैंसर का खतरा है और वो हम में से कोई भी हो सकती है. लेकिन अगर हम अपना मुआयना बाकायदगी से खुद करें और ब्रेस्ट कैंसर अर्ली डिटेक्ट हो जाए तो चांस ऑफ सर्वाइवल 90% बढ़ जाता है. इसलिए वीट एकेडमी दे रहा है शौकत खानम कैंसर हॉस्पिटल का साथ ताकि हमें किसी को खोना ना पड़े. टुगेदर वी कैन डिफीट ब्रेस्ट कैंसर. अगर आप भी डोनेट करना चाहते हैं तो स्क्रीन पर दी गई हिदायत फॉलो करें.
Right. Thank you so much for coming and then attending the session. Before we begin, we take cancer, we hear the word cancer and we get frightened. These are certain, you know, feelings are attached with cancer, ke खौफ है, agony, pain, death, you know, fright. But basically, what is cancer? Cancer, just on a very basic note, it's just the abnormal cells because there is wear and tear going on in your body. And sometimes those abnormal cells they tend to get collected in one specific part of the body, and they are very high on energy, and they can grow rapidly, and they can compete with the normal cells. So breast, being the gland which provides milk and nutrition to the newborn, is also prone to having these abnormal cells. Okay? So basic definition of breast cancer is when the cells accumulate in certain part of the breast tissue. Now, as we have discussed earlier many times, that breast cancer is the most common cancer worldwide amongst the females, which means that out of every 9 women, 1 is affected with breast cancer. That is the prevalence of this disease in our society. Now at Shaukat Khanam, the number of cases that we had, you can see 22% of the people that are coming in are with breast cancer. The second cancer being the CA colon and the anal region, that's 6%. Now आप देख सकते हैं clearly कि breast cancer is very, very, very common in our society. So this is a demographic representation of women losing their lives annually worldwide due to breast cancer. And you can see that Pakistan is in the red zone. It's clearly not doing good with the numbers, because women are dying of a cancer which has a high curability rate. And compare it with the neighboring countries or other areas of the South region or South Asia region, where in spite of the fact that the population is big and the area is big, they have greatly been able to reduce the mortality due to breast cancer. And where is that gap? That gap is of lack of awareness. We have to make sure that the people are aware. Okay, so researches are being conducted, and researchers have helped us in understanding the disease better, and therefore having a better treatment plan. I cannot say कि ये reason है कि जिसकी वजह से breast cancer होता है. Maybe in the coming years we will have one-liner answer. Till then, what do we have? We have a safety plan. Safety plan में being aware tops the list. We have the importance of lifestyle modification. Researchers have indicated that if we make certain lifestyle changes, we can greatly reduce the risk of having breast cancer. Early detection is the key. If you are 20 and above, you should monthly examine yourself, and if you're 40 and above, you should get a mammogram done. What is a mammogram? We're going to talk about it. And in case of any if you find out something, seeking immediate help. I have seen many cases where people come up with simple pain in the bone, but it turned out it was breast cancer. And the girls are really, and the women actually, they are actually just ignoring it. Okay, the lump was there, that's not why we came. We came here because of the bone pain. Little knowing that that bone pain was due to breast cancer. So who is at risk? Basically everybody is at risk, irrespective of the caste, irrespective of the creed. And yes, men have breast issues also, hence they are also at risk. Men get breast cancer too.
I know a man who was a breast cancer survivor.
Yes.
So which is why I also propagate that everyone should be just aware. I think we are more passionate as women.
Yes, because obviously the female
breast tissue is much larger,
yes,
the risk is much larger. But for men also, I think we should always be aware of everything that is happening.
Absolutely. And try telling that your acquaintance that, it's just 1%. He's the one who is affected, right?
Yes.
So anybody is and everybody is at risk. So risk factors की अगर बात करें, so there are a number of known risk factors where we can work on and we can reduce the chances of having breast cancer, versus those factors where we cannot do anything about because they're the non-modifiable ones. We carry those along, they're just there. The non-modifiable being female, with growing age the chances of breast cancer increase. and having a positive family history that, like we played in the video earlier, having a strong family history increases your chances of having breast cancer. Early onset of a period menstrual cycle, if it is younger than 12, or when the reproductive cycle stops after the age of 50, which is called menopause, also increases the chances of breast cancer. Having delayed children after the age of 30 or having no children at all puts the person at risk. And there are certain genes which are expressed in the cells, BRCA1 and BRCA2 being the most common ones. If they are present, we cannot do anything about them. Now let's talk about things that we can do and what we can work on. Okay? Diet being top of the list. For us, diet, the word diet is synonymous to losing weight. We go on a diet when we have a wedding season coming up, we go on a diet as a New Year resolution. But what we don't see is what is the importance of diet. Remember earlier we spoke about those abnormal cells that tend to get collected. We get antioxidants which are great substrate that your body needs to fight those bad cells. Fruits and vegetables being a great source of antioxidants. You must have observed that nowadays the trend is of eating meat more, consuming more meat. Unfortunately, not having your greens or not having your vegetables is just going on the downside, and then we say कि जी cancer हो बढ़ रहा है और heart diseases बढ़ रही हैं. But look at what we are eating. Youngsters tend to prefer chicken. They want to have chicken most of the time, forgetting the fact that white meat ka great source is fish, which is great source of antioxidants. Living in Karachi, we have excluded fish from our diet. Green tea, whole grains. Again, going on a diet, leave certain food groups, carbohydrates chhod dein, aap ye chhod dein, aap fat chhod dein. Not realizing that the importance of balanced diet is really significant, provided you want to keep yourself healthy, and especially with regards to breast cancer. Active lifestyle. Active lifestyle just does not mean going to a gym or exercising. It can be a simple walk. It can be a simple activity of just climbing up and down the stairs. Nobody wants, time constraints hote hain, I understand that, but giving time to yourself is really important because health comes first. The definition of health is that it's not just a mere absence of disease, it's a complete state of emotional, mental, physical well-being so that you perform better. So again, exercise, it's very cliched, exercise करें, वज़न कम करें, ये सब चीज़ें आप सुनते हैं, but it is really significant in regards to breast cancer also. Then we talk about weight. Weight ka concept again is like losing weight. People who are skinny are told to gain weight. People who are overweight are told to reduce weight. However, weight has to be measured in terms of the height, BMI. In terms of the age of the patient, of any individual, not just the patient, BMI. Any individual. My BMI might be different from hers. It all depends. So finding your body mass index or your BMI is essential. We have to stop fitting in a certain, statistics that the society has laid out for us. That you have to look like a certain shape, you have to have a certain color of the skin. Let's stop that. Let's just focus on our health. Okay? Breastfeeding again is known to decrease the risk of breast cancer if you breastfeed the child. Smoking. Okay. Smoking, we can go on and on. Again, Shaukat Khanam takes it upon themselves. More than 15 types of cancers are caused by breast cancer, are caused by smoking. Imagine. And it's not just the act of smoking, passive smoking also plays a role. It is so harmful, and unknowingly we are exposing our loved ones to these harmful carcinogens, cancer-causing chemicals with every puff that is given out. Alcohol consumption increases the chances of breast cancer. And there's this treatment which certain women go through that's called the hormone replacement therapy. If not monitored correctly or if given for a long period of time, can increase the chances of breast cancer.
What is hormone replacement therapy?
Okay, certain women, when they go through menopause, when their reproductive cycle finishes,
Okay.
so to curtail the symptoms, they get the HRT or the hormone replacement therapy.
Achha, this does not entail birth control or anything.
No. This is pertaining to
This is
OCPs, menopause.
menopause.
Okay, so another part of our safety plan is early detection. That's the key. Timely detection, again, बार बार बात होती है, treatable cancer है, क्या importance है, हम इस बारे में बात करते हैं. Over here you can see in stage 0, the abnormal cells are there. However, they are, if timely found and if timely cured, what is the probability of surviving that? 100%. My friends, 100% for a cancer, that's a tall claim, but it is actually true. Stage 1 mein, the size is less than an inch of the tumor. Again, over here, the curability and the survival rate is 98%. Compare it with stage 2, the size is bigger, the underarm is involved. Stage 3 mein, multiple sites inside, within the breast and the underarm. Udhar bhi probability बहुत बेहतर है. Again, 52% hai. For stage 4, you don't have to be a doctor to understand that the cancer has spread in a lot of areas of your body, your brain, the lungs, the liver, the bones, being the most favorite sites of breast cancer. So people come up in the hospital with a simple headache, turned out brain tumor, turned out primary site was breast cancer. So it's really unfortunate कि stage 4 पे हमारे पास अगर आए, survival rate 16% है, finances are, a big challenge. The treatment of cancer is very expensive. And then losing a patient to that cancer again, which is treatable, which is curable. She must have gone through so many stages to get here. So again, the highlight over here that I would like to emphasize on is early detection is really important. Early detection के लिए आपको पता होना चाहिए कि आपका normal क्या है. What is your normal? Because everybody is different. Everybody's anatomy is different. Shapes, sizes, everything is different. So knowing your norm is really important. Okay? Signs and symptoms of breast cancer include lump. Lump जिसे हम उर्दू में गिल्टी, गांठ, घुटली कह सकते हैं. These are the layman terms that are used. It's basically where the cells are collected in one site. However, not all lumps are cancerous. That's the doctor who will decide what needs to be done to investigate whether this is cancerous or not. Other signs of breast cancer include if there are skin changes, the skin is dimpling, there are any rashes, any red area, if the nipple is inverted, initially it was outside, but now it's inside, it's not in the center anymore, it has changed its place. The skin of the breast is no longer soft, one area is red or rash. So these are certain signs that you have to look out for. Other than that, if there is any discharge, may be clear or pussy or bloody discharge, these are big telltale signs. Examination of breast is really important. All you need is 5 minutes of your time every month. That's all that it takes. How to examine yourself? Basically putting your hands on the side, looking for any loss in shape, changes in the size, koi redness to nahi hai. These are certain signs. Because skin is not dimpling, it's not puckering, the nipple is in the central area, is there any discharge? So these are certain signs that you have to examine. First your hands on the side and then after raising them. The second step is doing an examination, feeling your breast area while showering, because your skin is moist, you have soap in your hand, so it makes it easy to palpate. The next step is repeating the same examination while lying down. Now, the next question that automatically arises is when to do it. So, women with normal menstrual cycles should do it at any time of the month, but 6th to 7th day is preferred, because that's the time where the hormones have settled, and if there are any tenderness in the breast, that settles down. Mothers who are nursing their children should do it any time of the day or of the month, it's up to them. Women who have had their menopause can also have it any time of the month, as well as the women with irregular menstrual cycle. Now, how to examine is really important. Using your first 3 fingers and the top part of your fingers is really important. And starting from one breast outer area, you go up and down, feel for a lump. जैसे आम है, आम में गुठली होती है, इस तरह से महसूस हो सकती है कि there is something going on that needs to be, that's not there. You can palpate it. Work your way up and down, right to the inside, and then repeat it on the same breast, the other breast. The second part is starting from the nipple area, working your way out in circular motion, again feeling for a lump, okay? Working your way out to the outside to the breast area. And in the third step, imaginary lines bana le from the nipple area, working your way out towards the breast in 8 sections. In this way, chances of missing out on a lump is greatly reduced. You would be able to find it, God forbid, if it's there. And obviously seeking help, even if in doubt, because again, a lot of women, especially during these sessions, have come up to us and say, we have a doubt, I'm not sure. So it's always better to get it checked. What's the worst that doctor can say? The worst that doctor can say is it's absolutely fine. Yes, I'm saying it's worse because again we have this general concept कि पैसे दिए doctor को और कुछ नहीं निकला. So again, it's the worst, People say that? Yes, yes. हाँ, कुछ नहीं निकला. That's happened. That's actually COVID test करा दिया, negative आया है. So again, this is the myth. तो लोग कहते हैं, हम सुनते हैं. Okay. So along with self-breast examination, we have mammograms. Now, what are mammograms? Basically, the X-ray of the breast tissues. Okay? Again, people tend to say, okay, this is very expensive. No, it's not. It's a very economical test. Compare it to the cost of getting yourselves treated. Then, the other myth that comes along with it is it's very painful. It's absolutely not painful. It can be discomforting, but then obviously getting yourself, tested with a blood test is also not a walk in the park for a lot of people. So please compare it with getting a surgery done or getting yourself treated for cancer. अगर एक साल में एक मर्तबा अगर आप अपना mammogram करा लें, so you could be saving a lot of lives, and you could be saving a lot of hassle. You could be saving a lot of money. ठीक है? And when mothers get sick, now it's the entire household that gets affected. Because you see, you want to run and you want to tell your mother everything. You think it's a given that the moms are in the house. Okay, so let's talk about treatment. The treatment of breast cancer is available. We have surgeries, we have chemotherapy, where the medication is given for the cancer, radiotherapy, radiation, and hormone therapy. Again, it depends on the type of the tumor, the stage of the tumor, the age of the patient. So it's a very individualized plan. So before we proceed further, any myths that you have heard about breast cancer? Because since we don't talk about it, so we tend to assume a lot of things. कि ये इसलिए हो जाता है. Have you guys heard anything? So let's see. Anybody would like to contribute कि कुछ सुना है breast cancer? Again, बात तो होती नहीं है, लेकिन अफवाहें बहुत हैं. Let's see what are the myths. Yeah, please. देखिए, every intervention has obviously certain risks involved in it. but hardly it's a 10 to 15 minute, the duration of a mammogram is 10 to 15 minutes. So those radiations are not harmful because you're not standing there 24/7. It is harmful probably for the technicians who are, if they're not handling it properly. But it's absolutely fine to get it done once a year. It doesn't increase the chance of breast cancer. Okay? So myths क्या associated hai? Certain people think that drinking too much coffee can give you breast cancer. That's not true. Microwaves are absolutely safe. So are the cell phones.
Okay, I have one then.
Yeah.
Wearing different colored bras.
Oh yes, oh that's the, it's there. The black ones are being very, yeah, so they're being the infamous ones. It does not matter whatever you want to wear, however you want to wear, it has to be comfortable, it has to be the size, it is up to you. So again, it's a very strong myth that's prevalent in the society.
I think hygiene is necessary. I think
obviously, that is, that's really important.
Yes.
And certain people think that speaking of hygiene, certain people think using roll-ons, yeah, deo sticks can give you cancer. That's not true. That's just a myth. People tend to run away from you if you don't use that. Otherwise, breast cancer though is, very much not the reason. Okay? Unfortunately, it is true, but people think that if you touch a patient with cancer, you can get cancer. And again, very disheartening stories. We have lots of them to share, thinking it's an infection that you can. बहुत बुरी बात है, इस तरह से नहीं होना चाहिए. Cancer is not spread by touching a cancer patient. ठीक है? With that, thank you so much for being a wonderful audience. And if there are any questions regarding breast cancer, I would love to answer them.
Yes, I think you've been extremely precise about everything. मेरे पास भी जो सवालात हैं, you've given every सवाल का जवाब. So, if anyone in the audience wants to ask a question, raise your hand. There is one raised hand.
No, it's absolutely fine. It's everything to do with your hygiene, and maintaining a hygiene, proper hygiene is really important for the general status of the patient, right? Of everybody, not just the patient, everybody. So that's a myth.
Is breast cancer genetic by any?
There's a probability, no?
Yes, as we spoke through them. If we can have that slide. Having prior history of breast cancer in your family increases your chances of having breast cancer. That's true. But having said that, if there is no prior history, it does not mean that anybody cannot get breast cancer. It just increases the chances.
Anyone else? Any questions? There's a raised question. There is your voice does not.
Your voice is very powerful.
I'm no sister, and only going to educate my mother regarding this.
Yeah.
I do not know how to start the conversation with her, how to start this thing, and what resources to share with her. If there are any videos on YouTube explaining the self-check process.
Absolutely. Yes, it's a taboo, and it's great that you're actually thinking about spreading this message. We do have these leaflets which you can start. That's a great icebreaker. There are authentic websites. Going to NCBI की website या cancer awareness की there are very good authentic websites. जैसे Mayo Clinic की अच्छी है. NHS has great sites where you can have these videos. You can find these videos which have breast examination in them. So you can always show those. They're not really graphic. They're very pictorial and very nicely done, very mellowed down, and that's a great way to, family groups where, you tend to share a lot of jokes. You can share these videos and information. This Veet ka jo bhi, that video that was played, that's a great video to start talking about,
Yeah.
That's a great icebreaker.
I'm so glad that we got this question
Absolutely.
today. This is the reason why we have sessions, so people actually can have conversations, and especially coming from a boy.
Yeah.
I would like to clap for you, by the way. Please. बिकॉज आई थिंक हम लोग अपने मकसद में पूरे होते हैं जब हमें इस किस्म की बातें
बिल्कुल।
जो है वो सामने आती है, बिकॉज यही मकसद है. और डॉक्टर आयशा, आई कैन नॉट थैंक यू इनफ
Thank you.
फॉर होल्डिंग दिस सेशन, फॉर
Thank you.
गिविंग अस सच एन एक्सट्रीमली डिटेल्ड व्यू अबाउट. मैं तो मुझे डर लगना शुरू हो गया था, मुझे फेक पेन्स भी होना शुरू हो गए थे. मे बी आई एम एन एम्पैथ probably. But in the closing statement, I would like you to please sit
Thank you.
down. In the closing statement, I would like to say that I would like to thank Veet for taking part in this initiative and being so forward in educating and aware in making people aware that breast cancer is prevalent and one of the most common cancers in society. एंड मैं शौकत खानम को भी और वीट को दोनों को जो है कॉन्ग्रेचुलेट करती हूँ कि ये कोलैबोरेशन से जो है, जिस तरह से इस लड़के ने सवाल पूछा, इस तरह से और सवाल उठेंगे, इसकी गुफ्तगू और मज़ीद जारी रहेगी. थैंक यू एवरीवन. आप सबको शुक्र है. प्लीज़ ये मैसेज मेरी तरफ से जाके, आप सबकी तरफ से जाके अपने घर वालों को बताएगा. मेरा माइक भी बंद कर दिया गया है, कोई मसला नहीं है. मैं भी कराची यूनिवर्सिटी से ही हूँ, मैंने इसी तरह से बात की है. तो ये सिर्फ यहाँ तक ख़त्म नहीं हो जाना चाहिए सेशन. हमारा मकसद यही है कि आपके थ्रू और लोगों तक ये कम्युनिकेशन हो. डॉक्टर आयशा जो कर रही हैं, जो वीट कर रहा है, जो हम सब यहाँ कर रहे हैं, प्लीज़ इस मकसद के तहत कि आप यही बात, यही मैसेज आगे
लेके जाएं.
थैंक यू सो मच.
Thank you so much.
थैंक यू.
Bye bye.